So for this video, I'll be going over the mental health highlights out of chapter 34. You have neurosis. This is where the person knows they have a problem. They remain oriented to reality, but have some degree of distortion or reality manifested by a strong emotional response to the trigger event. Then you have psychosis. This is out of touch with reality. They have severe personality deorientation. They have impaired perception and judgment, hallucinations, and delusions. Probating. This is the involuntary admission when a person is thought to be a danger to self or others. The DSM-V, they give the Multiaxial System. This is mental disorders are classified and various disorders are descriptive references are outlined. All 5 axes, when used together, facilitate a holistic assessment useful for comprehensive care. Delirium. This is a temporary and rapid change of consciousness. Possible causes include physical illnesses such as fever, heart failure, pneumonia, azotemia, malnutrition, drug intoxication, and anesthesia. Then you have a person with nocturnal delirium or sundowning syndrome, displays increased disorientation and agitation only during the evening and nighttime. Dementia, this is an irreversible, slow, progressive loss of intellectual function. Schizophrenia. So the main characteristics of thought process disorders is bizarre, non-reality based thinking. Schizophrenia is one of the most profoundly disabling mental illnesses. So behaviors that schizophrenic individuals display, they fall into different categories. You have positive or excessive, negative or absent. The prognosis for individuals who exhibit positive behavior patterns is good. So these positive behavior patterns include delusions, hallucinations, and disordered thinking. And then for your negative behavior patterns, those include apathy, social withdrawal, and flat affect. So positive behavior patterns, delusion, it is a false fixed belief that cannot be corrected. A hallucination is a sensory experience without a trigger, and auditory hallucinations are the type people experience most. You have disordered thinking, such as loose association, and that's speech sometimes, loose association making in speech sometimes makes this evident. Concreteness is conversation that does not flow logically. So for example, you say, watch your step, and they literally look for steps. Then you have the negative behavior patterns. Apathy, this is lack of energy or interest. Alogia is reduced content of speech. Affect is the outward display or expression of emotion that is felt. Flat affect is lack of nonverbal expression of emotions, such as by means of facial expression or tone of voice. And anhedonia is the inability to experience happiness or joy. Subtypes of schizophrenia, you have catatonic. This includes posturing. So for example, they'll stand on one foot. The stages of schizophrenia. So you have prodromal. This begins in adolescence and begins with lack of energy or motivation and withdrawal. You have the pre-psychotic phase. This is where the individual prefers to be alone. And then in the acute phase, the individual loses contact with reality and is unable to function in the most basic ways. Next, your major mood disorders. Hereditary factors account for 60 to 80% of the cases of mood disorders. The levels of norepinephrine and serotonin are deficient in depressed individuals, and the norepinephrine is excessive in manic individuals. So depression, it is a mood disturbance characterized by exaggerated feelings of sadness, despair, lowered self-esteem, loss of interest in former activities, and pessimistic thoughts. Suicide warnings and precautions. So for the person who is depressed, often they have suicidal thoughts. So this person is going to have withdrawal from family or friends, talking about death or suicide, drug or alcohol abuse, personality changes, difficulty concentrating on work or school. Bipolar disorders. So bipolar disorders or manic depressive disorders feature shifts between emotional extremes from depression to mania. Mania, it is a mood disorder whose major characteristic is persistent, abnormal overactivity and a euphoric state. And then the early phase of a manic episode is often referred to as a hypomanic episode when symptoms are not severe. So medical treatment for mood disorders, you have antidepressants. They take 2 to 4 weeks for the effect to kick in. You can give lithium, the ECT. You want to remember that the patient has to have a driver or the treatment will be canceled. And then psychotherapy. Anxiety. So anxiety is a normal response to stress or a threat. Signal anxiety. This is a learned response to an event such as taking a test. Free-floating anxiety is associated with feelings of dread whose source cannot be identified. You have panic, an attack, which is an attack of acute, intense, and overwhelming anxiety accompanied by a degree of personality disorganization, such as the inability to solve problems or think clearly. In a panic attack, symptoms occur abruptly and they peak within 10 minutes. Panic attacks are characterized by at least 4 of the following. So your heart palpitations or accelerated heart rate, sweating, trembling or shaking, feeling of dyspnea or choking, nausea or abdominal distress, feeling dizzy or faint, and paresthesia. So that's the numbness and tingling feelings. You have agoraphobia. This is an extreme anxiety brought on by situations in which a panic attack is possible. So people will avoid people, places, or events that have the potential to trigger an attack. So this is like your person who stays inside or at home all the time because they're afraid to go out of the house. Phobias. A phobia is an irrational fear in which the thoughts of the individual tend to dwell on the object of the phobia. Next is obsessive compulsive disorder. Remember to separate the 2 words. So obsessions are the thoughts that are recurrent, intrusive, and senseless. These thoughts are anxiety producing and distressing. Compulsions are the behaviors that are performed in response to an obsessive thought. The repetitive, ritualistic behaviors such as checking the locks 10 times before going to bed typically reduce the anxiety and tension produced by the obsession. You have PTSD. This describes a response to an intensely traumatic experience beyond the usual range of human experiences. Flashbacks often arise in response to a trigger and often include illusions and hallucinations. And the treatment for PTSD, antidepressants or anti-seizure meds, cognitive therapy, behavioral therapy, and debriefing people right after the event is one strategy recommended to prevent PTSD. You have many sexual disorders. Paraphilias are a group of sexually gratifying activities that are not common in the general public and are illegal in some countries. So you have sadism. This is achieving sexual arousal from inflicting pain or humiliation on another person. Sexual masochism refers to sexual arousal by achieving mental or physical abuse. So in sadism, they're inflicting the pain and they like it. In the masochism, they're receiving the pain and they like it. Exhibitionism is flashing. This is exposing one's genitals. Frotteurism is sexual arousal by rubbing up against or touching a non-consenting individual. Fetishism is the use of an object, usually an article of clothing, to attain sexual arousal. Transvestic fetishism is wearing clothes of the opposite sex, so this is like cross-dressing. You have psychomatic illness. This refers to a physical disorder arising as a result of a psychological trigger. Somatization, also known as Somatoform Disorder. It is a disorder whose typical characteristics are recurrent, multiple physical complaints and symptoms for which there is no organic cause. So they think there's something wrong with them, but there's nothing there. Eating disorders. So you have anorexia nervosa. It is a severe form of self-starvation that potentially leads to death. It occurs predominantly in adolescent girls, but can occur at any age in both male and females. And the nursing interventions, you want to understand that the focus is not on the food, but on the individual wanting to feel in control. Next is bulimia. This is commonly known as binge eating. This is episodes of overeating that are followed by purging by means of induced vomiting, laxative, diuretics, fasting, or vigorous exercise. It typically occurs in white girls of high school age, and they can give Prozac or Zoloft to help control this. So treatment methods, psychoanalysis. This was developed by Sigmund Freud. It is a long-term and intense form of therapy that enables the patient to bring unconscious thoughts to the surface. Free association, which is speaking thoughts without censorship, and dream interpretation are among the tools in psychoanalysis. You have adjunctive therapies, which can include occupational, recreational, art, and hydrotherapy. They allow expression of feelings, help increase self-esteem, promote positive interaction, and reality orientation. Limits of confidentiality. The nurse has a duty to warn. The nurse is obligated to report if the patient has an intent to hurt themselves or others, so secrets are not allowed to be kept. You have the ECT, the electroconvulsive therapy. This treats depression, mania, or schizoaffective disorders. It is an induced seizure and it's used as a last resort treatment. The course usually consists of 10 treatments over several weeks, and the patient is NPO for at least 8 hours before the treatment. Do not allow the patient to drive until the confusion is gone, so the patient must have a driver or the treatment will be canceled. So let's wrap this up. Don't forget, patients with depression have lower amounts of neurotransmitters, norepinephrine, and serotonin. The therapeutic range for lithium is 0.5 to 1.5. It takes 2 to 4 weeks for antidepressant drugs to reach therapeutic drug levels. Neurosis is a person remains oriented and they know they have a problem. Psychosis, a person is out of touch with reality and doesn't know they have a problem. Probating is the involuntary admission when a person is thought to be in danger or self or others. Delirium is temporary and rapid. Dementia is irreversible, slow, and progressive. It is an organic mental disease secondary to cerebral disease. A delusion is a false, fixed belief that cannot be corrected. And one of the types of delusion is the grandeur delusion. This is the belief that you are someone with great powers to control any situation. For example, saying, I am God, or I am the president, or I am Madonna's husband. A hallucination is a sensory experience without a stimulus or trigger. They are usually auditory, so the person hears voices. Positive schizophrenic behaviors are delusions, hallucinations, and disordered thinking. Negative behavior patterns are apathy, social withdrawal, and flat affect. The stages of schizophrenia are prodromal, pre-psychotic, acute, and then residual. 60 to 80% of cases of mood disorders are caused by hereditary factors. Warning signs of suicide, talking about suicide, drug or alcohol abuse, difficulty concentrating on work or school, personality changes. Adjunctive therapies are used to increase self-esteem, promote positive interaction, and enhance reality orientation. Loose association is a type of disordered thinking that occurs when the individual cannot interpret information and the conversation does not flow. A person with catatonic schizophrenia maintains a pose for long periods of time, such as standing on one foot. The term for parrot-like repetition of words is echolalia. Thanks for watching.